Only on Fox 23 tonight, vaccinated or not, some men are finding it more difficult to return to life as they knew it before COVID-19 when it comes to romance.
We sent Fox 23's Rick Marinon to look into claims that COVID-19 is doing serious damage to men in both their 20s and 30s.
And we do want to warn you, this story focuses on men's sexual health. So some of what you hear may not be appropriate for younger viewers.
It's not an easy topic to talk about, but more patients are talking about this with their doctors. Young men who should be at their sexual peak are finding after they were sick with COVID, they've lost their sex drive. They can't get turned on like they used to, some not at all. This new ailment is so new, there is no official name for it yet. But for now, many are referring to this as COVID-linked erectile dysfunction. When it comes to the long-term effects of COVID, we've heard about the heart, the lungs, and the brain. But now more healthcare professionals are starting to see something else. Damage to the penis, causing erectile dysfunction. How new is this diagnosis for y'all? You're still learning about this, is that right?
Absolutely. I mean, no one really knows what the total consequence is going to be. I mean, but yeah, I mean, it's an ongoing thing.
Greg Gerard is the general manager at the Tulsa Men's Clinic. He says they first started noticing problems linked to COVID-19 and sexual performance last winter. As the pandemic progressed and Oklahoma experienced 2 waves of the illness, more men began to come in with the same ailment after recovering from a COVID infection. Have these people had problems before COVID? Was there any kind of warning sign?
No, most of them have picked it up during this last year.
These cases of erectile dysfunction are not the result of getting older. In fact, this isn't impacting older men at all. The men coming in are younger and have recovered from COVID-19, and their once happy love life has seemed to disappear just like the infection.
We've seen more cases of men in their mid to late 20s, where usually you won't see anybody until their early or mid 40s.
Dr. Basil Hassoun is a urologist at Mercy Health in Oklahoma City. He too has seen more men come in seeking help after getting sick with COVID, and it didn't matter if they were vaccinated or not.
There has not been any official studies. There's anecdotal experiences about it.
Hassoun says research has already showed COVID-19 could damage the blood vessels in the other parts of the body. Now research shows that the virus can damage the small blood vessels and hinder blood flow to men's genitals. That hindered blood flow affects performance. Plus, the virus can actually linger there longer than in other areas of the body and cause impotency. Hassoun says it's too early to see if quality and quantity of semen is impacted by COVID. If so, that could reduce the chance for a successful pregnancy or even increase the risk of birth defects.
The penile tissue is a spongy tissue, almost in anatomy equivalent to the lungs in terms of the vascular structure. So by having these microvasculature being affected, the blood flow to the genital area can be affected significantly.
In the past, there's always been that little blue pill to help with these sorts of issues, but Viagra and other performance-enhancing medications like it may no longer do the trick. At the Tulsa Men's Clinic, they are doing shockwave therapy to try to revive and increase blood flow to the damaged blood vessels. It's almost restoring them to what they were before the patient had COVID. So far, Gerard says that shows the most promise and will likely be the best path forward, at least until they know more.
Normally, our therapies, like for instance, shockwave, is about a 6-week, and you will know whether or not it's been reversed within probably 45 days to 60 days.
There are some things that can't be fixed with pills and shockwave therapy. Both experts agree that dysfunction is often caused by COVID triggering an underlying pre-existing condition that would have needed treatment later on in life, like hypertension or diabetes.
A lot of men used to be able to blame their sexual dysfunction to fatigue, having to work so much and so forth. Now that they are staying at home, a lot of these underlying issues are being unmasked, coming up to the front to be dealt with.
As with any new medical discovery, it's expected that this could take at least 2 years for more information to come in. Keep in mind, if you do need the help of a doctor or you have a concern, go ahead and seek out that one-on-one consultation in the privacy of a doctor's office. Remember, we wouldn't know about this problem if other men hadn't sought help from their doctors before and the medical community started to take note. Covering news that matters, I'm Rick Marinon, Fox 23 News.